Hey Manny, how are you? Manny, can you hear me?
Yes, I can. Can you hear me?
I can hear you okay. How you doing?
I'm doing great.
Great. Just want to introduce you to our audience as usual. Um, Everyone, welcome to the Darshan Talks live stream. I'm your host, Darshan Kulkarni. It's my mission to help you trust the products you depend on. As you know by now, if you've listened to me before, I'm an attorney, I'm a pharmacist, and I advise companies with FDA regulated products. So if you think about drugs, wonder about devices, obsess over pharmacy, this is a live stream for you. I do have to say that I'm an attorney, but I'm not your attorney. My guest today is a physician, but he's not your physician. I'm a pharmacist. I'm not your pharmacist. So this is neither legal advice nor clinical advice. I do these live streams because they're a lot of fun. I find myself learning something new every single time. It'd be nice to know if someone's listening. So if you like what you hear, please leave a comment, please subscribe. If you want to ask our guest questions, please feel free to do so in the chat box, and if appropriate, I'm happy to pull it in. And After the talk, please share the video. Please invite people to listen in, and we appreciate that. If you want to find me, you can find me on Twitter at Darshan Talks, or just go to our website at darshantalks.com. Our live stream today is going to be really interesting. We've had our guest today a few times before. I'm really excited to have him on again. He is, and I'm going back to his profile. He is a theoretical physician, and I'm very curious to know how he came up with that term. And I'm really excited to have him. He's the author of the award-winning book, "The Future of Healthcare," and he's Dr. Emmanuel Fombu. How are you, Manny?
I'm doing great. Yourself?
I'm doing great. Thank you for coming on. I love the background. Actually, it's very, very pure. It's white, so it's good to have you on. So we're gonna start, Manny, by talking a little bit about what you've been doing recently. I mean, you talk about writing this award-winning book of health, the future of healthcare. What was your central premise in that?
The premise there was, being in healthcare, being in a clinic, being in pharma, being in startup companies. I realized that those, yeah,
I'm not hearing the echo. Are you hearing an echo?
I am on my side, but it's okay. We'll just continue. And so I realized that there was a lot that technology could do in healthcare, right? To bring a lot more value to exactly what we do. Uh, in general, today, when a person actually gets sick and they go to see a clinician, that is like a one-stop point, right? So the way I look at it is like if you look at like a picture and a movie, I think the interaction today between patients and healthcare providers, it's like a picture. It's like an old school picture, like a snapshot. Is like it captures the moment in time. But technology has the ability to actually capture a movie about our lives, right? And we could use that data to actually make more informed decisions, to actually have precision medicine and predictive medicine. And so I believe when I wrote this book was the idea to explain to everyone in layman terms what exactly artificial intelligence is and the value that it has not only to patients but to providers, to pharma, and to payers as well.
So it's funny you talk about artificial intelligence because that seems to be the basic premise of the book. I find it interesting because I've never quite understood what people mean when they use the term artificial intelligence. And the reason I ask this question is people seem to use different things. Is machine learning artificial intelligence? Is neural networks artificial intelligence? What do you define as the term? Do you use it as at a more meta level, if you will? And what do you see as the impact of AI or artificial intelligence on healthcare in the future? Is it just the predictive and the precision medicine part of it, or is it going to revolutionize everything else we do as well?
I think AI, in general, could be summarized into prediction kind of models, right? I remember being in college and taking a class called logic, right? And it was all about opening a tap, if this, then this, right? It's the same kind of logic here. And the great way to look at it, I think in healthcare, we use the word AI too much. I think it's actually should be retired. But if anyone here has, anyone listening, has Netflix or you have Facebook, and you watch a movie, for example, the first time you actually log in on your Netflix, they basically have no idea what you like, right? And you have your own personal profile. You could be in the same house with, your wife, kids, and everyone else, or grandmothers or grandfathers, but everyone has a separate profile. And based on what they like to watch, you could predict the next thing that a person might necessarily be interested in. And if you're on Facebook, on any other kind of, or even on LinkedIn, you realize that a lot of times you start watching one thing and then you can't stop watching, right? You keep watching other like cat videos and other kind of videos that you end up watching, is because there's that predictive algorithm that could predict that because you like this, then you most likely like this. So it's the same kind of idea of having a baseline data sets in healthcare and then predicting the next thing that happens.
So it's funny you talk about how we should avoid using the term AI in healthcare, because we do use it a lot. Like every futurist I know talks about AI and the promise of AI. But you are relatively unique in saying we talk about it too much. Talk to me a little bit about the promise of AI and where it's already faltered.
Correct. So if the way medicine works in general, I remember being in training, my clinical training after medical school. What you do is when the patient comes in and the patient has a complaint and they say, I have a headache, for example, or I have stomach ache. What you do is you ask more questions. And the more data that you have in as a clinician, that helps you make the most likely diagnosis, right? And then you have differential diagnosis, like so based on the symptoms, based on the age of the patient. So you take a lot of information together to actually make a decision to narrow down what tests you need to perform to actually come to your conclusion. That's how medicine works. Doctors do this every single day. Even if you leave your home, for example, and you're driving and you see traffic in front of you and you decide to go left because you don't see traffic there, it's the same kind of idea here, right? And so I think is the way it works. But I think today, if you look at how much data we have around, how many new publications come out and things that we learn every single day, it's impossible for any one clinician to actually possibly, consume all that information, right? And so there are multiple ways in which artificial intelligence could benefit people, like all of us. When I say people, I'm talking about every person, each one of us, right? Not necessarily just patients. For one, if you look at the idea of using wearables, for example, predicting the risk of people having AFib, that's something that Apple does today with Apple Watch. If you look at voice, being used, to diagnose Alzheimer's, depression, suicide. If you look at, people writing text messages or chat groups, and you could actually flag that alert and alert someone to actually reach out to someone if someone is suicidal. And if you could actually build these algorithms also in something I call clinical decision support, then you could embed this within EHR systems actually to help clinicians actually assist them in actually making the best informed decision to actually diagnose patients, especially patients with rare diseases. So I think it's an aid, right, that assists us to make the best decision. I don't think it's a tool that should be on its own and making decisions on its own, because of course nothing is accurate, but I think it's humans and machine partnering for better outcomes.
Now it's really interesting. You talk about the importance and the value of AI acting in, as you put it, a clinical decision support system methodology. But how do you deal with the issue of overwarning? Because as we all know, systems have good intentions. Systems start by saying we want to help you, but then and I hate to say this to my fellow people, but as lawyers then get in the way, and we go, well, we shouldn't be not warning, because if we don't warn, that's exposing the hospital or the doctor's office to risk. So let's give even more warnings. Now suddenly the doctor's gone from, oh, this is a valuable piece of insight, to I know for a fact that yes, Colace might interact with aspirin, but I'll just get over it. So how do you teach an AI that this is an important enough warning and don't warn me on these others? Or do you think that both sort of need to coexist and the AI will learn from what you sort of ignore on a consistent basis?
It's a great thing, Darshan. I mean, you're a lawyer. I think in healthcare, I think a lot of lawyers in the space are extra conservative in how they do things, right? I think especially if you look on the pharma side, where pharma companies, you develop drugs all the time that actually goes in people's bodies, right? People are actually taking these drugs that go and place with the cells, with side effects sometimes or not, but it benefits patients. We're talking about algorithms here that are being used every single day, right? Whether you're using Netflix, if you're using Waze or Google Maps, these algorithms are being deployed. And somehow these tech companies somehow have lawyers that actually help them deploy these things, even though it's still regulated, right? We have self-driving cars right now that probably exist still, and there's still a risk, but those lawyers find a way to make it happen. I think that especially with legal and compliance, I understand The fact that we're talking about humans here, and you can't. It's not like a car where you can go back and say, "Oh, there's an accident. I could fix this part." We only have one life, but I think that we need to work together to make sure we have the right framework in place to actually execute these solutions, because I think the benefits outweigh the risk.
It's funny you talk about that because it's such a important consideration, right? Because we've been talking a lot about how technology is developing, healthcare is developing, and technology companies, in many ways, are going farther ahead than what healthcare even allows for. What I think is an interesting result out of that is multi-billion-dollar corporations, whether you talk about Haven, which is JP Morgan and Amazon, and I forget who the last one was, but Berkshire Hathaway, thank you. And then you talk about Google, and you talk about Apple, all saying we're going to disband our healthcare practices. So you made the point a few seconds ago that lawyers find a way of dealing with it, compliance finds a way of dealing with it in the technology world. Question is, do they though? Or did they find out that it was just too complicated and it's just not worth that engagement, even for the tech companies? Your conversations with the technologists, what have you found? Do you find that the lawyers there are just different? It's a different mindset, or do you think that they tried and then they had to give up?
I think we need lawyers in the industry that are familiar with tech and how we can deploy it around a certain framework, right? I think in healthcare, we're probably the only industry that waits for the FDA to give us guidance before we act, right? If you look at planes have been flying using, like we have planes on autopilot all the time. If any of us fly, right? That's what happens all the time, and that's okay, right? And I think there's a lot. We need lawyers that are not trained necessarily just in the idea of like, okay, there's a pharma perspective and follow the same kind of rules that function for drugs, but have lawyers that understand tech, understand how we could deploy it, and actually be proactive in creating a framework altogether. I think it's a community kind of effort, not just with the lawyers, but I think we need to create a framework and then present that to the FDA rather than wait for the government to actually create frameworks for us. I think we are the only industry that does
that. So it's funny you talk about that, because one of the key pieces, I think, of a situation where lawyers are the part that are actually the brakes, if you will, in the system, is this idea that in the privacy world, because pharma and FDA and healthcare all want patients to benefit from the treasure trove of data that we're getting. However, what we've also seen is that pharma companies, medical device companies, then decided that why, instead of this data belonging to patients, why don't we own the data and we commercialize it, and therefore we make millions, if not billions of dollars off that data? Do you think that the lawyers were wrong? And again, wrong has different levels and stuff like that, but we're inappropriately sort of stifling innovation by talking about privacy the way we do now? Or do you think privacy is going the right direction from a healthcare perspective?
I think there are multiple things wrong with how we deal with especially the digital health space, right? If you want to sell a digital health solution to a health system or the clinician, a lot of times the point of contact is probably an IT person. That's where the conversation goes. There's a lot of conversation taking place without the providers being involved in that conversation or the patients being involved in the conversation. It's strictly a tech discussion. And that's why you see adoption being very hard to actually, for us to actually get adoption in this. I think we need to have people that actually prescribe in these tools, to involve them, to educate them about what exactly we are doing on the tech side. Because most times, the most conferences I've gone to, most people actually end up spending time talking to are tech folks, engineers, entrepreneurs building this, VCs driving that conversation. And rarely do we have clinicians involved unless they do a study and then they publish a paper. But we need more clinicians in the forefront, making them understand the differences between all the solutions available for them to select what is the best solution for them. I think we need to create a community, like a one-stop shop community for all of us to get together and educate ourselves and then drive this forward.
So it's funny you talk about the importance and the value of bringing in the different stakeholders. I 100% agree with you, because I think that we've been so obsessed with this idea of disruption, that we've forgotten that sometimes you have to understand why the system exists before you disrupt it. And speaking to clinicians, speaking to patients will give you a better idea that yes, you can in the tech world, if you break quickly and move forward, that's okay. But you have, as you put it, just one life. So patients cannot adapt to the next version will be better than this version model. You've got to get it right the first time. Um, so I guess my question to you is, this is my what I gave to you was my perspective on disruption. Do you think the term disruption has been overused, or do you think that healthcare is still ripe for disruption? We just need a different type of disruption.
Dasha, what other industry talks about disruption? Even when Netflix beat up Blockbuster, they didn't talk about disruption, right? Disruption just happens and you see it happen, right? I think in healthcare, we use the word disruption quite a bit, and we get quite fascinated by, honestly, I think in the digital health space, we're actually more interested when companies raise capital than what they actually deliver, right? So companies will raise capital and everyone is happy and we'll cheer them on. Or if you raise $100 million, $200 million, and then it disappears, and then if they get acquired, we'll talk about it. It's a very VC-driven kind of business kind of conversation that happens in digital health. We don't focus on learning from the patients and sharing those stories of how it benefited someone's life, right? I think that conversation needs to go back to the patient, the reason why these tools are created, and the impact it has on patients and clinicians and how it improves healthcare. I think we'll get a lot more adoption and things will be much more smoother than having this conversation driven strictly by the idea of investing. And we look at success based on how much returns investors made.
So what I hear you saying, and please feel free to correct me if I'm wrong, what I'm hearing you saying is that stop focusing on the dramatic impact you'll have at a global scale. Talk about the individual patients whose lives you're affecting and ask them for that feedback, ask the clinicians for that feedback. Is that a fair analysis of what you're saying?
Yes, I think that's a fair analysis. And if you look at like Apple's marketing for the Apple Watch, you see many press releases about how it impacted someone's grandmother, right? Apple talks about that particular story about what happened. Apple doesn't say, "Oh, we disrupted healthcare." We talk about Apple disrupting healthcare, right? We talk about Amazon disrupting healthcare. They don't talk about disrupting it. They make the solution. You feel it yourself, right? You feel it like it's completely disrupted. And that comes down to the conversation that Sharon we're having right now, where during COVID, like this whole COVID period, the pandemic, telemedicine has been something big. Today, if you go on multiple chat rooms within the digital community, everyone is talking about, oh, do we go back to the old way? Is it going to stay this way? Why would it stay that way? If you could talk to a clinician right now, like I'm talking to you right now, right? I mean, I'm talking right now we talk to video chat and we have people around the world listening to us right now. What is the difference between us having this conversation? Do I need to drive down to your house or sit down next to you right now to have this conversation? Right? I mean, like we adapted to that already. We use FaceTime to talk to each other. So the idea that we're having this debate about should we go backwards? No. Instead, we should create that framework from what we've learned so far during this period, and how can we make that experience much better going forward?
So I guess we're changing topics from privacy and disruption in digital health to telemedicine, which is always such a fun topic. We started off talking about the hype of AI, and at this moment we're talking telemedicine. I love our conversations. My question to you, you said, why would we go back to the way things were? Let me challenge you. A lot of the physicians I talk to, a lot of the clinicians I talk to are completely overworked. And a lot of that has to do with the fact that your consults are now becoming shorter and shorter, and you're putting them right next to each other. The result of it is you're doing a lot more work a lot quicker, but you're just filling in the space with more work. So do you think that instead of becoming more productive, you're just becoming more efficient? So instead of actually doing better patient care, you're just doing more patient care. And that is one of the reasons physicians and clinicians in general are saying, I want to move away from telemedicine, which is extremely good, but it's now forcing me to burn out. And what is your thought on clinician burnout that goes along with?
Clinician burnout is something that's real, and it was there even before COVID, right? So it's been something that's there, and it's something that's highly driven by this fee-for-service kind of model. I think when we talk about healthcare, everyone talks about is the patient first. I think it's about the patient. I think it's about convenience. You have patients that live in rural areas. They're sick. They don't feel well. They have to drive several hours to go find a clinician, in a major city or a neighboring place. We enjoy sitting down in a clinician's office, right? Sitting there waiting for hours and hours to talk to a clinician when you can make that happen right away. how much time is that people take off work, right, to go see a doctor's office all day. If you have a doctor's appointment today, or even before the COVID, even right now, you have to literally go in there, make an appointment, sit down, and wait for hours just to see a clinician, and then you leave. It's like the entire day is all taken. People have to be disrupted on how they take care of kids. I think it's about the patients, about convenience. It's much easier for all of us to stick to the way we do things before. But I don't think anyone will have that argument that, I believe in the face-to-face kind of interaction with a clinician when necessary, right? I think it will drive down costs significantly and make things more efficient and more convenient for everyone.
So, what I heard your response to be all about was the patient, which 100% I'm in agreement with you that they are the most important entity in that conversation. However, what I'm going to challenge you on is, yes, we with telemedicine you get to reduce the amount of effort that the patient needs to make, which I think overall is such a great thing. It adds certain advantages. As you said, you just avoid some of the wasted time that goes along with it. But I'll give you an example. Yesterday, I was calling CVS to get a prescription refilled. I was on the phone waiting for 30 minutes before someone picked up the phone. And the reason I had to wait was because 2 CVSs around had closed, and that one CVS was handling all of the work. The question I have is, the result of that was because pharmacists are going, there's just too much work. I can't handle this. It's not worth it. It's causing me mental distress. Is that clinician burnout we spoke about before? Do you foresee a future where we're going to have to rethink how we do things? As telemedicine basically part of that? And what does that new model look like in a world where Emmanuel Fombu controls the world, where you can balance the needs of patients with the needs of the providers who are helping those same patients? Because otherwise the patients aren't being helped because there are no providers to do the helping.
That is interesting. Actually, in my book, when I wrote it, I actually predicted the point, that a time in which when you go see a doctor and the doctor writes your prescription, by the time you get home, you have your drugs already delivered to you, right? Even today, I get ads all the time on my phone with Uber actually delivering drugs, right? Uber could deliver drugs. Amazon could deliver drugs, right? Pharmacies are doing these delivery services at home right now. Why can't a doctor just prescribe a drug? It goes straight to the pharmacy, your local pharmacy. They have your address and they get the drug delivered to you. That happens with groceries today. We do that with groceries right today, and that happens. So I think it's about making things more convenient. We don't need to keep sticking to the way things are. No one enjoys the way healthcare works right now. I'm not saying if you need some kind of surgical procedure, of course you want to go in. If you need something that needs more significant intervention, of course you should go in. What is happening right now in this space is, you see outside telemedicine, the biggest challenge there is, how does a clinician actually take measurements of vital signs at home, right? And you have multiple companies that are very innovative. They're building great solutions today that you could use to measure. You could do echoes at home today, right? You could do ultrasounds at home. They're portable devices that connect to iPhones. I could do that today. That makes things very convenient. I think the future of healthcare is one in which care will be delivered wherever you are, right? I think the idea of building big hospitals and building big offices and people going to sit there, I think those days are over. We could resist it, but it's going to happen. And the person that drives healthcare in most cases, especially in the United States, are payers, right? They get to pay. Look at the profit margins of insurance companies when COVID hit. They've been very profitable. So why? Because it's cheaper to do these kind of solutions and it makes sense. And if you could monitor patients remotely, you could actually identify and diagnose patients earlier, put them on therapies earlier, rather than wait for them to get sicker when intervention is actually pretty bad. So I think this is here to stay, and it's going to go forward over time.
Manny, we can keep going, but as you know, I usually aim for these to be about 15 to 20 minutes, and we're already at 26 minutes. So it's always such a fun conversation. But as you know, I ask you like 4 questions before you go. The first one we've already been answering the whole time, but just so everyone can hear, for those people who are just on audio, how can people contact you?
You can shoot me an email, ef374@cornell.edu, or you can check out my website, emmanuelfombu.com.
Perfect. My next question for you, what would you like to ask the audience?
I would like to ask the audience if they think it's time for us to have a digital health community, right? That is not LinkedIn, right? That we get a chatting. I think a group where we get together, we discuss policies, we discuss things that we think barriers to us adopting like these solutions, meeting each other, creating this kind of partnerships, learning about what's happening in this space. And so creating this partnership. I think we need to work together and support each other. And, if you're on the pharma side, you're in the hospital side, you see entrepreneurs, let's engage with them, right? And because they're working hard to make things happen. So let's work hard closely with them to make the solutions possible.
So let me ask you this question, because you said something interesting there. Having a digital health community that is not LinkedIn. Why did you draw that distinction?
LinkedIn is for getting jobs, right? LinkedIn is for getting jobs. LinkedIn was not based on the idea of us sharing objective kind of information, right? So people get promotions and, oh yeah, I got this new job, or I got this new thing. And it's a great community for that. But when I talk about policy kind of discussions, like things that are very informative for us to communicate with each other, understand differences between all the digital solutions that exist today. If you're looking for a partnership, maybe there's someone there that could help you with a partnership piece, that you're not like harassing people in the inbox, right? Because no one is there for that connection kind of piece. But I think a community where people are there to say, this is my problem that I have, and someone can come up with a solution, we can all work together.
I can definitely see the value of that community, but I think you'd have to then build it in a way that that people, because what you risk at that point is everyone with a very interesting topic will have their own community. So as the audience, you then have to go into 15 different communities because you have so many interests. What LinkedIn gives you is a central place, but to your point, it doesn't let you engage in the same way. It doesn't let you do the in-depth conversations. So I think your idea is right, but I think you're thinking more of a interactive publication community, if you will, as opposed to building a whole new Facebook or a whole new LinkedIn, which I think is a really interesting take.
Correct. If you have your job title on LinkedIn and you make any comment, that means you're representing your job, kind of, right?
So, as a lawyer, I disagree with that comment altogether.
Exactly. So a lot of people are very kosher on LinkedIn. Yeah. So you want to be very proper how you say things, right? You can't challenge certain ideas. I mean, some people do, right? But it's a formal kind of piece where you don't get this objective kind of conversation where people could say, hey, I don't know this, please help guide me, right? And make me, we need that safe spot for us, safe zone.
Safe space. Fair enough. Next question. What is something you learned in the last month?
In the last month, I realized how difficult it is for people to change their minds. I realized that there's something called death of expertise, right? I'm still having debates right now with friends that refuse to take the COVID vaccine, and they're lawyers. Well, actually, my buddy he's a lawyer, and everyone's an expert right now on how clinical trials are done, and they never did any papers, right? So I realized that humans are difficult.
Great takeaway. My last question for you: what is something that made you happy in the last week?
I received some shipment of local foods from Cameroon for my mother. so that makes me very happy, eating my traditional foods.
Are you a bit of a cook, or was it more just raw kind of fruits kind of stuff?
I love cooking.
Well, there you go. We learned something new about Dr. Fombu today. Now I'm gonna have to look up Cameroonian foods. So I think that should be a fun topic. But this was wonderful, and we got to get you on to actually talk a little bit about what kind of recipes you make as a physician. Is it as healthy, or do you just go for taste? Because I think that'll be a fun conversation to have. Go ahead.
It takes hours to make this meal, so right. So it's not like a daily thing that you have. So you can cheat once in a while.
Fair enough. Fair enough. Manny, it was wonderful having you on. I hope you'll consider coming back again.
Of course, anytime, Dashad. Thank you very much.
Thank you again.